right, so this is going to be my week 5 fundamental skills video, and this is going to be over my NG tube insertion. So the first thing I'm going to do is just knock on my patient's door, provide privacy behind me, do my hand hygiene as I come in. I'm going to acknowledge my patient, introduce myself, let them know what I'm about to do, how long it's going to take, and then thank them for letting me do, put in the NG tube. So first, I just want to pull my patient's chart and just kind of review history of any any problems with their nasal, kind of nasal throat area. So any recent trauma, nasal polyps, any sinus infections, any oral, facial, or sinus surgeries that I need to know of, if they're on anticoagulation, and then if they have had any, any aspiration, or are they on aspiration precautions, that kind of stuff. And then I'm just going to ask my patient their name and their date of birth and just verify it with their ID band. I want to make sure that I have an order, that I'm putting in the right type of tube, and then usually I like to check and make sure if it's if it needs to be hooked up to suction, then I want to get that suction stuff ready already, just to so I can have that and just hook it up right there. Then I'm going to do my hand hygiene, and then obviously I would put on some, just regular gloves. Then I'm going to inform my patient kind of what I'm about to do, which they're probably already a little bit informed, but just let them know I want to get verbal consent that it's okay to do it, and then just answer their questions and let them know that it's going to be uncomfortable and that they're probably going to have when the tube does go down, that they'll probably have some gagging and stuff like that. So just kind of make them aware, and it's not a fun procedure. So just let them know that. Next, I am going to assess their pain, and then if they have any nausea or any vomiting, if they need something maybe some Compazine or some Zofran prior to putting this in, if they've had nausea and vomiting, that would probably be a good idea. And if not, if they, are having vomiting, make sure an emesis basin is near them, or have another nurse hold that if the patient cannot hold it. Next, I am gonna prepare my tape. So this tape is I had some old tape here. So the best to use is silk tape. So I'm gonna do 3 pieces total. I'm just going to put them on the side of my table here, or my bed or whatever, and I'll show you. So I did 2 regular pieces, and then my 3rd piece, I'm going to show you how I'm going to. Okay, so I know this would probably need to be longer. Obviously, it should be 3 inches. I don't think this is 3 inches. But I'm just going to tape I'm going to undo it and undo some little legs, so like this. And then I'm just gonna put that on my bedside table. So I have 3 total. So after I get my tape ready, then I can put some, if I didn't already have gloves on, put some gloves on, clean gloves, do my hand hygiene, all that good stuff. I want to kind of just assess their nasal with my their nasal passage with my pen light. So I'm just gonna kind of take my pen light and just look up at their ears here. So I want to look for any obstruction, any polyps, any irritation, and then any septal deviation. And I just want to make sure, I know we went over the history already, but just going over it and just being okay, you don't have a history of nosebleeds, you don't have a history of this. Just making sure before you put that in there, because that could really mess some things up if you put it in there. And then so I like to assess nair patency, or I also ask them some people have had these before, and one nair works better than the other. Not always. I mean, most people, sometimes they're young and they've never had one, so sometimes you'll know which one, or which one do they prefer. Sometimes I'll ask. What was I gonna say? Sorry. Oh, assess for nair patency. So if you just have them close one nair, and just blow out, just making sure that it's patent. Do that on both sides, just so if they're, or have them blow their nose too, just so they're not blowing stuff out when they do that. And then you're also going to assess their gag reflex. So you can take I can't even think think what it's called. Like not a popsicle stick. Sorry, I can't even think what it's called. I think you know what I mean. You're gonna put that kind of in the back of their throat. Obviously, if they're like nauseous and vomiting, I mean, yeah, I don't know. I mean, you still want to test it, but just be like cautious if they're nauseated and they're vomiting. So next I'm just gonna auscultate their lung and bowel sounds just to get a baseline assessment if I haven't already. So I would just go through and take my stethoscope, and I would, you know, listen to my lung sounds, and then I would listen to my bowel sounds here and just make sure if they're coming in for like bowel obstruction or something, they're probably not gonna have very good, they're probably gonna have hypoactive bowel sounds. So just being aware of that. So next I am going to measure. So I'm gonna go ahead and take my NG tube out of the package. And I would have gloves on. I don't have any like regular gloves at my house, so we're just gonna pretend that I have gloves on. And then what you can do is just kind of have this kind of like wrap it up in your hand and kind of get it a little bit warm so it goes in easier. Oops, just fell out. Just because, you know, it's hard, it's plastic. So I'm gonna go ahead and measure before I put my lube on. Sorry, I'm not actually inserting this, so I don't know why I'm warming it up. Okay, so I'm gonna take the tip here and I'm gonna go, sorry, I'm gonna hold that there, to my earlobe. And then I'm just gonna pinch at my earlobe, and then I'm just gonna go to like my xiphoid process here. And I would say I'm right at, I would say about 70 is where I am. So I am going to, let's see, I should have grabbed another piece of tape. I know that you can either tape it or you can add, sometimes I'll just like put a Sharpie, like, you know, Sharpie on mine. I'll just go ahead and tape it just for video purposes. So you can see that it's at 70 here. So I'm gonna go ahead and just flag a piece of tape there, just so I know. Wait, hold on, let me redo that. I feel like it's easier just to put it with Sharpie, but sometimes that can be like hard to see, so. All right, so, okay, that's better. I have it like flagged now. Okay, so next I am going to, I don't have any lube to show, but I would obviously put some lube about like 4 inches, make sure it's lubed really good, and just make sure that it's like kind of, you know, that it's flexible enough to go in. So now that I have measured, I am going to go ahead and insert. And so I'm gonna have my patient up at like 90 degrees. And what I'm going to do is have them, so when I put it in, your patient's gonna go back anyways, like it's just natural, like someone is sticking something up their nose, and it's actually good that they're kind of like back a little bit. So what I'm gonna do is I'm gonna go ahead and start. So I'm gonna go with my left nair, because that's where I measured. So I'm gonna go ahead and go up, and I'm gonna start going back. And what I'm gonna do is when they start to, and I'm also, I forgot to say this too, hold on, getting ahead of myself. So I'm gonna have my patient, if they're able to swallow safely, like with a straw, and they're not NPO, they can, you know, have, well, most of the time they're gonna be NPO if they have a bowel obstruction, but just having them eat like some ice chips even, or just like drinking a little bit through a straw, or sometimes just if they cannot, if their swallow is not the best, sometimes just having them just do the maneuver of swallowing, that helps kind of push the tube down. So what you're going to do is I usually, and I think it's a good distractor too, if they're able to swallow efficiently, I usually have them drink, and I feel like it's kind of a distraction because they're just like drinking and drinking. So what you're going to do is when you start putting this in, you're gonna get a little bit of like a gag reflex. So you're gonna have them start swallowing. So when you start to put it in, you're gonna say swallow, swallow, and you're gonna have them tuck their chin as you start to advance. And with each swallow, you're gonna advance a little bit more. So you wanna keep telling them, you know, like, I mean, you don't wanna like force it in really fast, but you also don't wanna do this slow. because it's really uncomfortable. So when you tell them to swallow and they keep swallowing, just keep pushing it through. So you're swallowing, you're gonna have them tuck their chin, and you're gonna keep going, keep going, keep going, keep going, keep going. Okay, so now I'm at my mark right here. See, this is why I don't like using tape, because then I feel like it's like in their nair, and I would not like that. So I would probably just use marker, just because I feel like that's really uncomfortable right there. Just so it's not like in your nose, because you're going to want to assess that site anyways, and I feel like with the tape being there, it's really hard to see. Okay, so I have it here. So what I'm going to do, I'm just going to put this behind my ear really quick, and then I'm going to take a piece of my tape. Looks silly. It's probably going to hurt taking it off. Okay, so my tube is there. This is going to be really hard to show my tape. So what I'm going to do, and I didn't say this earlier, but I'm going to let that just flop for a minute. You would have like, I don't have a piston syringe, but you would get like a 60 ml syringe and you would hook it at the bottom before you even put it in. This is so you would like assess your pH. So at this time, if I had a syringe, so you're going to clamp your, so my syringe would already be there. So I'm not even, so let's say this is my syringe and I'm going to pull back just a little bit, just a couple mils, and then I'm going to clamp it to take out the syringe. So I took out the syringe and I'm going to put it back so it's clamped, you know, so it's closed now. And I would just test my pH. So stomach pH should be between like 1 and 4. So I would do that with my pH paper, put it like in a little medicine cup and test that. And then after, so sorry, that was like my self-identified break, I guess, because I forgot to say that. So I'm going to get this kind of taped down. You don't want to tape it, you want to tape it well enough that it stays for right now, but honestly, so you're going to send your patient for a KUB, but you're probably going to have to move it, to be honest, because I always have to move it when I put mine in. So when you do these little like leg things, so what you do is you put it on the bridge, and it's really hard to do this on yourself for one, but you kind of just like wrap these around. So the little wings kind of wrap around, and it's easier if it stays in the, oh, well, see that did pretty good. And then usually I just put one across the top right here. I'm not going to because, you know. So once that's in, I would go ahead and, I'm gonna take this tape off because it's hard to talk. I'm just gonna pretend that it's there. Okay, so I'm gonna go ahead and listen to my patient's lung sounds just to make sure, you know, that I don't hear anything abnormal from my baseline. And then, like I said, it's secured, send my patient down for a KUB. I'm not gonna hook it up to suction. I'm not gonna do anything until I get this KUB done. So after I test my pH and everything, let's say it's been a couple days, and I'm gonna remove my NG tube now. So what I wanna do first is I just want to listen to bowel sounds to make sure that they're there, because you don't wanna remove it if the bowel sounds are not there, because that could be an indicator that this is not, it's not ready to come out. So what I'm going to do is I am going to have my patient hold their breath, and just for prevention of aspiration. And I'm gonna undo my tape here, undo the wings or whatever, and I would put like a towel across their chest, just to get, if anything comes out, like gunk and everything. And then get some water for them, just so after I take this out, it's not, you know, grossness, just not sitting in their throat. So I would undo my tape here and hold it securely. Oh gosh. Okay, and then what I would do is I would have my patient hold their breath, or, you know, take a deep breath, hold their breath, and then I would just kind of pull it out. So I'm pulling it out, pulling it out. Okay, so it's out, and I'm just gonna wrap it up, and then I would just kind of wrap it up in this towel, and then I would dispose of it. Okay, so I'm gonna move on to my documentation. Before, I didn't say this in my earlier, but when I would take the tube out, I would obviously assess for like making sure that it was intact. And then once I was able to throw everything away, I would take off my gloves, do my hand hygiene. I would reassess my patient's pain, and I would reassess their nausea too. I mean, if they got something before it's probably not going to be time for them to get something else. But if you didn't give anything and they're still very nauseous, or, you know, they kind of have, that's a very uncomfortable feeling. So they may need something afterwards. Cause you don't want them to vomit, because then you could, you know, forcing that tube out, you really don't want them to vomit. So reassessing pain, seeing how nausea is. I want to make sure that their side rails are up, or at least ×2. The bed is in the lowest position. Wheels are locked. You know, bed chair alarm is on wherever they are, and then do my hand hygiene. So if I was going to document, I would obviously try and do that in the room, but sometimes that doesn't happen. So first, I'm just going to make sure that I'm in the right chart, and just verifying that, just checking to make sure. I don't know what tube I put in actually. Oh, okay. So I want to document the type of tube and the size. So I did a Salem sump pump, and I did a 14 French. So I definitely want to chart that. The technique that I used, so I tested the pH, so I would want to document that. And then I will, I'm sure that there's a place to document what the pH was, if it showed, you know, if it showed on there. And then character and amount of drainage. So when I pulled out that little bit of gastric juices, like what color was it? Was it brown? Was it green? And then I would, characteristics, I mean, well, amount, I guess. How much, it's hard to do. I mean, it's hard to really put amount of drainage, because it's, I mean, you did pull out a little bit, but I feel like amount of drainage would be more like when you're hooked up to suction, amount of drainage. That's what I would think, because majority of the time you're going to get that KUB before you even hook it up to suction. So maybe amount of drainage would be later on down the road. And then I want to chart my my bowel sounds and my respiratory assessment, my baseline and my after one. If there was any you know, different findings, I would want to chart that. And then if I did any like hygiene, if I mean, nasal, it's hard to chart like nasal hygiene, you know? I mean, if you kind of like, you might have like cleaned it out. If there was a little blood, maybe you could clean it out. Oral hygiene, definitely recommended. You definitely want to keep that up, especially if your patient is NPO. So you would want to chart that. If you like moisten their lips, or, you know, mouth swabs and all that good stuff. So you would want to do that. And then document your teaching that you performed, and how the patient, you know, were they able to, if you did any teaching, which I'm sure you did, because I feel like we're always teaching. So you would want to document that, and then document the patient's tolerance. So if they tolerated it well, if they didn't tolerate it well, you would want to chart that. And then, what was I going to say? Oh, and then just sign your work. So just making sure that you're, you know, that is attached to you, that you're signing your work, and yeah, I think that's it. And that concludes my video.